Engagement Director with NC Child. Thank you so much for joining us on our weekly legislative update and COVID-19 focus call. Talking to you after the end, or at least an adjournment in the legislative session early this morning, and there was plenty of news to talk about, things going on legislatively and otherwise this past week. We have with us again Mr. Matt Gross from North Carolina DHHS. Matt's kind enough to be with us after this marathon last few days of the session, and we certainly appreciate that. He's going to be sharing some information with us, and Whitney Tucker, the Policy Director for NC Child, will also be sharing a legislative update, and encourage you all to ask questions. If you want to put your questions or comments into the chat box, feel free to do that throughout, and we'll try our best to get those questions answered. And afterwards, we'll have an open Q&A as well after our presenters speak. But first, I'd like to go ahead and get things started with Matt. Thanks for joining us again, Matt. I know it's been a busy week. We always appreciate your updates and your insight. So take it away.
Sure, thanks for having me. And I don't want to steal too much of what on the ledge update, although that's really the world I've been living in for the last couple of weeks. A little more in the COVID world, but I know there's some ledge questions probably about some of the bills that passed that directly relate to us. I'm happy to dive into. I know a big one a lot of folks have been watching is Senate Bill 808, which is the Medicaid transformation bill. I think we got it to a pretty reasonable place, given that it became clear that there was no unsevering of transformation from the Medicaid rebase, which is really, really important. The rebase is particularly larger this year, not just because of COVID, because we also didn't do a rebase last year. And really without the rebase, the Medicaid program would be in a pretty bad spot midway through the year. And the rebase number they gave us is, it's close enough to what we think it should be that we think it was reasonable. There's always a little disagreement between us and the legislature, but it was pretty close. So we don't have any real complaints about the rebase number. Some big things that we were able to get changed in that bill this week that made it more palatable. One, the penalty that could have been upwards of $18 million a month that we would have had to expend out of DHHS resources to hand over to the health plans if we couldn't go live by July 1st is out. I'll say we certainly have every intention of trying to launch by July 1st, and we're going to work incredibly hard towards that deadline. We also know there's not a value in flipping the switch on a managed care program that's not ready yet, so it seems a little problematic to have that penalty in there, especially given that when we look at our funding, the vast majority is either federal or tied to drawing down federal funds. So there's actually not a lot of places you can just cut state funds that wouldn't have a match issue. So it would have been really hard it would have had a big impact on our day-to-day work. So glad that came out. Also worked really hard to get an additional $100 million for testing and contact tracing, which is going to be really essential as we look towards our testing plans we're developing. One of the things we've been running into is where insurance companies and HRSA will cover the first test for somebody or test for somebody who's symptomatic, even maybe multiple ones. They don't cover when we just want to start doing blanket regular testing of places like long-term care facilities and other areas where we know that there's risk for outbreaks. So that money will be able to help pay for some of that testing work we want to ramp up. Also on the contact tracing front, we've done, I think, a really good job with our contact tracing hiring thus far through CCNC with a really big focus on diversity. We want to make sure that as we're doing contact tracing, you're asking people to voluntarily give a lot of personal information about their life, and you need to make sure you have trust between the people doing that work and the community they're working in. So we did a big focus on trying to make sure that what we've done thus far, we get contact tracers that represent the populations they're working with, a big focus on people that are bilingual or multilingual, not just Spanish, but Burmese and other languages that we see are spoken often in some of the meat processing plants and other places we're seeing outbreaks. From a contact tracing standpoint, we hired 250 folks with the first run of COVID money. We really need to scale that up by probably at least another 1,000 or more, so that money will help pay for that more contact tracers, which will be really helpful. Another thing in there that was really one of the last pieces we're able to negotiate into the bill is $20 million for early childhood. We know that the childcare industry is really suffering. I think about 60% of, I think it was 60% of the centers or 60% of the slots are only running at 6% capacity. But either way, we know that childcare teachers are on the front lines of this. We've got to get them some more bonus pay. So that will help. We're going to create another bit of a bonus pay structure. I don't have details on that yet, but that money will help pay for that. I think we're also going to be able to give some to Smart Start, who's looking to do some work to really help do family engagement work for children who lost access to high quality childcare or pre-K during COVID, and schools coming and readiness is important. So really happy to get some of that money to support early childhood. That's really key. Then there's other provisions in that bill that are positive, a little more for mental health. I think it's a $20 million net gain for mental health. I say from a departmental standpoint, really happy to get the whole Granville debate off the table. That was a real strain and stress on a lot of our staff, and was actually helping make it easier for people to pick off our staff. So getting to stay in Wake County is really, I think, important for our ability to function and continue to partner with all of our sister agencies that are here in Wake County. So all of that was good to see. Another bill I'll draw your attention to was our agency bill, which is fairly benign and technical. It became Senate Bill 168 late into the night. And you'll see a lot of block grant language in there that's really something that usually shows up in the budget, and is what we have to do because the legislature, the way they run the block grants through and they control it so much, we have to actually note where we're getting more money coming into the state for them to allocate it out to us. So you see all those fluctuations. Again, it's a pretty standard process that would just go unnoticed in the budget, but get that done. For example, the at about $14.7 million. We got an extra $1 million to spend with that. We needed to get that actually allocated so we could get it out the door. So important items in that bill that we were able to get done, some other technical changes. I know y'all did a lot of work on 918. I'll let Whitney talk about that. It was really, I think, heartening to see how much people recognize that that bill, although well-intended, is really not the right solution, and a lot of support reinforcing that's not the right solution. I really hope the bill sponsors will continue to work with us. I know we've spent years trying to get that in a good place and didn't get nearly as far as we wanted to. Another bill I'll draw your attention to is House Bill 612, which is another one that has the right intention of wanting to make sure we're properly aligning social services guidelines and policy with rules and laws. Again, a challenging aspect with that bill is the way it has us going about it is a timeline that's completely unworkable and would result in a lot of important guidelines, guidance, and policy just disappearing, particularly about how to enforce federal laws. And where we volunteered to keep doing the work and are already doing it for 5 areas that are in front of the Rules Review Commission. I was disappointed that our language continued to in that. And there's a lot of other items in there that I know caused some issues for the treasurer, and I think a lot of other state agencies. So I think that's another really problematic bill. I was pleased to see it was a pretty split vote on that one, which I think shows that folks are recognizing there's challenges with that one. But I worry that in its current form, all we would be able to do in the social services space for the next year is focus on what that bill makes us do, and we'd still fall really short. And then you'd end up getting back to a place where there's a really big lack of consistency among how the counties are doing their work. So hope we can get to a better solution on that one in the long run. I'm trying to think. There's so many other bills that were flying around last night. I say I'm happy to stop and to see if there's questions about specific legislation. Although before I do that, I want to throw a plug in the press availability today, which we do 2 to 3 days a week, is at 2 o'clock. A big focus on today's press availability is what we're trying to do for outreach for the Latinx community, because we know COVID's spreading really far within that community. So I recommend checking that out. It's usually streamed online or in a lot of the TV stations, but the Secretary's press availability too today is going to really highlight our Latinx community. And if there are folks here that work with those communities that don't feel like that they're engaging with us on how to address COVID, please reach out to us, because we want to make sure we're engaging with everybody we possibly can. So with that, I'm happy to pause and see if there's any questions.
Well, and I just want to say real briefly too, Matt, like I really appreciate the work that was done on SB 808, and I feel like that bill got tremendously better. I was surprised, to be honest, how much of a better turn it took over the past week. So kudos for working on that and getting out some provisions that I know many of us on this call felt like were very troublesome.
Well, I'll say, a member of the folks on this call I've worked with regularly is Representative Dobson, and this is unfortunately going to be his last session. setting all partisanship aside, just the embodiment of what you'd want in a legislator. It's been so good to work with, understanding issues. I think he was instrumental in creating the space that we could have the right conversations with the Senate and get to a much better bill. So really, really happy that he was helpful with that, and we'll certainly miss him going forward. I see some questions in here on the rebase. So the Medicaid program, you're generally going to see cost growth in it, both due to enrollment changes and the fact that the cost of healthcare continues to rise. So every year we do forecasts what we think the Medicaid program will cost. Since it's an entitlement program, we have to fund it. And so the rebase is what you have to pay to get the program to where we think it's going to be for that operating level for the next year. Frankly, a lot of the shortfalls that Medicaid was facing in the early part of this decade were where there were some programmatic issues. A lot were driven by the fact that the rebase wasn't getting funded to where it needed to be. And I remember sitting in meetings where I'd hear at the time Secretary Chancellor say, with this budget, Medicaid is going to fall several $100 million short this year, and then lo and behold, it would happen. So getting that right so the program can run on budget, we don't have to look at things like provider rate cuts or service cuts throughout the year is really, really important. So that was one of those, it's kind of perfunctory, but also can be political at times and is really, really important. So glad to get that in there. And anyway, happy to take any other questions that folks have.
Any other questions for Matt?
If there aren't other questions, I want to encourage everybody to just give Matt a couple of snaps up or claps up for incredibly hard work this session on behalf of health and kids and social services. So big thanks, Matt.
I was just going to ask if you could briefly mention what's going on with the governor's latest announcement on COVID, and if there's anything that you think folks need to know more about that.
Wear your mask, wear your mask, wear your mask, wear your mask. It's been really frustrating to see how mask wearing has become so partisan, but there's so much emerging research showing that where communities in areas that have embraced everybody wearing masks, it really is cutting into the rate of spread for the virus. And that's the key, is everybody doing it. Because if you're wearing a mask and nobody around you is, you're not really protected. But if everybody wears a mask, we protect each other. It's such a good tool for looking out for everybody around us. I think it's how we really turn these numbers in the right direction to where we can lift more restrictions and get life a bit more back to normal. But mask wearing is really, really, really key. A little disappointed that some legislative activity happened around that last night that was negative, but hopefully we'll get that addressed in a week and a half. But I think that's really the big takeaway. Our numbers have not been going in the right direction. And what we're seeing is, there's a story about in Washington, D.C., how I think a couple haircutters turned out they had COVID-19, but they wore a mask and every one of their customers wore a mask, and they saw 100 people and nobody got it. And it was that really both people wearing it, that double barrier is so important. So I just implore everybody, I know it's a little uncomfortable at times, it's getting hot outside, but that is probably one of the single biggest things we can all do to get these numbers in the right direction and turn things around. So that's the big focus, is mask wearing.
Thanks so much, Matt. Let's see, do we have any other questions that have popped up?
Just seeing lots of love and appreciation coming in, but I don't see any more questions right now.
All right. So with that, then let's move on to Whitney Tucker, Policy Director for NC Child, who's going to provide a further legislative update.
Great. Fawn, could you get the slides up for me, please? Today, I thought it might be helpful to start with a federal update and then kind of move down more granular to a more granular level. I'm going to give these federal updates, and then it actually looks like Ashley Perkinson, our lobbyist, has been able to join as well. So then I'll turn it over to Ashley to give a quick overview of the timeline and what it's looking like at the state level. And then I'll go through some more of the bills that Matt mentioned, where there's just a lot that's been going on lately. So we'll jump right in. The top line message at the federal level is twofold. First, opponents to the Affordable Care Act are filing briefs with the Supreme Court right now to take away coverage, even during a pandemic. This lawsuit, California versus Texas, is aiming to strike down the ACA and would do terrible things if it were approved. It ensure that protections for 135 million Americans with pre-existing conditions are no longer available. If this bill goes through, our national partners expect that the uninsured rate in the country is going to increase by 65%. The case would undo Medicaid expansion, which now covers 17 million people across the country, though unfortunately not North Carolinians. 2.3 million adult children would no longer be able to stay on their parents' insurance. Financial assistance that helps 9 million people purchase healthcare in the marketplace will be taken away. I mean, there's just a lot. Basically, all of the good things that the ACA does, this would undo. The Center for American Progress estimates that roughly 23.3 million people would lose their coverage if this lawsuit succeeds. That's about 3 million people more than they forecasted prior to the pandemic. So this is very bad news. In contrast to that terrible happening, the US House on Wednesday released its ACA 2.0 bill. The bill's official title is HR 1425. It's called the Patient Protection and Affordable Care Enhancement Act. The House is expected to vote on the bill around June 29th. And this House bill that was originally slated for the ACA birthday provides just a portfolio of improvements to the ACA that makes coverage more affordable, that creates incentives for states to expand Medicaid, and that it addresses inequities by extending Medicaid postpartum coverage to 12 months and restoring Medicaid coverage for individuals who fall under the Compact of Free Association Migrants, or for folks who work in the federal advocacy space. You'll probably know them as COFA citizens, those who are lawfully residing in the United States. There are lots more provisions that really put this bill in stark contrast to the current administration's ongoing efforts to weaken ACA coverage, to strip consumer protections, and then to deliver profits to corporations. I was just going to run through a few top lines of the bill because we have enough time, I think. I'm not going to go into all the details of each of these, but if you have questions, please write them down and put them in the chat box, and we'll circle back at the end of the call if there's time. So top lines of this bill, it lowers the cost of coverage for ACA plans by expanding tax credits. It pushes holdout states like North Carolina to adopt Medicaid expansion. It makes it so that federal renewal, it renews the ACA's original expanded federal matching rate for states to adopt Medicaid expansion. And then over time, it reduces the administrative FMAP for those who continue to refuse, like North Carolina. So our federal Medicaid assistance percentage, that percentage that the state or that the federal government pays into the state's Medicaid program would go down over time if the state still refused to expand Medicaid. It also invests in consumer outreach, education, and enrollment by funding lots of different federal and state efforts to increase enrollment and educate consumers about their healthcare rights. It improves barriers to coverage and care with a focus on addressing barriers for communities of color. As I mentioned, it extends postpartum coverage to a full 12 months. It also requires states to extend Medicaid or CHIP coverage to new mothers for that full year, and improves Medicaid beneficiaries' access to primary care physicians by reauthorizing ACA's increased payments to primary care who treat Medicaid recipients. It cracks down on junk plans, strengthens protections for people with pre-existing conditions, and then finally it negotiates lower prescription drug prices. I mean, there are just a lot of really good things in this bill, and it is basically the opposite of what's happening in SCOTUS right now with the lawsuit against the ACA. So there are a few things you can do this week about this if you really want to take action on this particular issue. You could write an LTE. NC Child can help and provide you with a template from our national partners if you're interested in that. And also you can take to social media to really contrast the bill and the current administration's work against the ACA. We can also help get you some sample messages for that if you're interested in it. And so with that, I'm gonna, LTE is a letter to the editor. Someone has written a question, and that is a good point. I'm trying to do better with acronyms, y'all, so please continue to call me out on that if I say anything that makes no sense to you as it comes out of my mouth. And I'm gonna wrap up the federal updates with that and then turn it over to Ashley for a lay of the land at the state level and look at what our timeline is looking like and what we can expect moving forward.
All right. Thank you so much, Whitney. And I will echo the sentiments that were shared earlier of our deep appreciation for Matt Gross and his persistence and work throughout this short session. As he mentioned, some of the key bills we were following: Senate Bill 908, House Bill 1023, Senate Bill 918. And as Matt mentioned, the legislature did meet last night and on to the hours of the early morning. They actually adjourned shortly before 3 o'clock this morning. So very long evening and early morning session. And one of the reasons that it was it was a session to watch even on into the early hours of the morning is that we saw the emergence of a lot of bills that came in the form of conference reports. And for those of you who aren't familiar with conference reports, when the House and the Senate adopt legislation in different forms, but they want to move the bill forward and both chambers don't agree, then they put together what is called a conference committee. And so sometimes there can be brand new language in those conference reports, and the bills can be really long. So it was, there were a lot of those bills moving last night, and you would see language from one bill jump to another bill, even though it was the same language. So pretty dynamic time. But effectively, they are, in essence, adjourned for now. They have both chambers adopted an adjournment resolution for a date certain. So they'll come back in, they've got a date certain of September 2nd. So they will meet in skeletal session some until then, but the September 2nd adjournment resolution does allow them to come back to do veto overrides, to also look at additional appropriations if there are federal funds that are available to be appropriated. So we will continue to watch. It is possible that they could still come back before the September 2nd date to address veto overrides, et cetera. So we will be watching that, but it was a pretty abrupt end to a really fascinating short session to watch. I do also want to echo what Matt said about some of the legislators that will be retiring. Of course, we work closely with Representative Josh Dobson. There are other House members and senators who are retiring as well. Representative Floyd, Representative Hawley, Representative Speciale, and Representative McGrady, and Representative Presnell. And then on the Senate side, Majority Leader Harry Brown is retiring, along with Senator Erica Smith. And then a surprise announcement yesterday, Senator Tillman announced that he was retiring and not coming back, even though he had filed for re-election. So there will be a number of new faces for the 2021 long session. And we will continue to watch as the legislature moves forward to its September 2nd meeting date, and we'll keep you posted if there are events and developments before that time.
Thanks so much, Ashley. You know, if only you still had your residency in Randolph County.
Yeah, right. Not violent.
Because Senator Tillman, y'all, he's from Randolph County, which is where Ashley's from originally, and he's retiring. So I'm making a joke that she could be an esteemed senator. So everyone, do you have, oh, well, go ahead, Whitney. Sorry.
Okay. Yeah, I was like, haha, you thought it was over? False. There's a lot to cover today, guys. So I'm going to jump in. So I'm going in order from the things we like to the things we like the least here with what's going to the governor. So starting with good news, HB 1023, Coronavirus Relief Fund additions and revisions. Among other things, this bill provides funding for school nutrition programs, including eliminating the reduced price lunch copay so that all students who qualify for reduced price lunch will receive free lunch, and also covering transportation costs associated with delivering meals throughout the summer. The bill also extends the period of use for the funding that it provides from the end of the 2019-20 school year to December 30th, 2020 instead, which we really like to see. It's great news. It's good for kids. Next bill is HB 593. And this one we haven't been following quite as closely as the others, but mainly just because we have a small shop and a lot has been moving very quickly. This bill has gone through a lot of work in that conference committee process that Ashley was just outlining for you guys. All in one day yesterday, a conference committee was appointed for HB 593. The committee released its report. That report was approved in both chambers, and 593 has now been ordered enrolled and will head to the governor for signing. The bill cleans up some requirements around the functioning of juvenile crime prevention councils, or JCPCs, and it clarifies other things regarding the implementation of Raise the Age, like ensuring that youth under 18 aren't placed into adult detention facilities. Love to see it. SB 808, getting a little bit more complicated here. As everyone has mentioned so far, I'm not going to go into too much detail because we've talked about this bill some, but it underwent a really big change over the past week. NC Child, along with many of you, originally opposed this bill primarily because of the rushed start date, a 60-day timeline for Medicaid redetermination, and the harsh penalties that DHHS would have been required to pay each prepaid health plan if they needed, if the department needed to delay the start of Medicaid transformations contracts. But also just because we don't believe that the state should be trying to handle a public health crisis and Medicaid transformation at the same time. Thanks to a handful of legislators and some other great negotiators, including Matt over at DHHS, the bill has really gotten into a shape that we can get behind now. We still feel that Medicaid transformation should be delayed at least until the end of the COVID-19 emergency, but our most problematic provisions within 808 have been removed, and the bill now includes, as Matt mentioned, $100 million for COVID testing and tracing with a focus on serving historically underserved and at-risk populations, a little over $30 million to fund improvements to the NC FAST system, and I am pausing for dramatic effect, $20 million from the Coronavirus Relief Fund to DHHS for childcare related expenses. This is obviously not enough to solve our state's childcare crisis right now, but it is certainly more than the $0 of coronavirus relief funds allocated up until this point. And as you guys know, this has been a major point of advocacy for us this session, so we're really glad to see it. I'm ending this section on HB 918 because it's a bad bill that still requires you to take action. House Bill 918 would require women addicted to opioids while pregnant or using any other substances while pregnant to get treatment in order to retain custody of their children. The bill would not protect that mother from criminal prosecution or help her get into or pay for treatment. It would also decrease the amount of time to 9 months where a foster family is considered non-relative kin, effectively speeding up the adoption process. We have many concerns with the bill. It looks like we have enough time, so I'm going to run through them all because I think it's important for you guys to understand why we need to be reaching out to the governor on this particular piece. First off, there is no available estimate of the number of children who are likely to be impacted by the provisions of this bill or of the costs that will be incurred by the state in implementing those provisions. If enacted, secondly, this bill is going to result in more infants and young children being placed in an already overwhelmed foster care system. HB 918 does not fund or otherwise address any existing concerns within the child welfare system, including the ongoing and really severe shortage of foster parents. Third, the child welfare system has documented disparate outcomes for children and families of color that will be made worse by this legislation. Research has found that Black newborns are more likely than white newborns to be reported for substance exposure, despite similar rates of substance use by pregnant women of both races. We know already from our child welfare data that in our state, under the same set of circumstances, children of color are already more likely to come into foster care, while white children are more likely to remain with their families of origin. Debate about this bill in the Senate on Wednesday really had its proponents speaking to the goals of the legislation and its intent, but that is just not relevant in the face of its impact. The racial bias evidenced in our current system means that HB 918 will result in the removal of more children of color from their homes when there are viable alternatives to keep them safely with their families of origin. Knowing that is reason enough not to support the bill. This is an example of how racial bias becomes codified and transforms into systemic racism, and we have an opportunity to stop that. Fourth, 918 also penalizes parental substance use, but it fails to address the limited treatment options statewide. Only a fraction of North Carolinians who seek treatment and counseling for substance use disorder are currently able to obtain it, and this bill does nothing to impact the availability of that care. Fifth, there are also many different steps that our state could take to reduce children's time to permanency in the foster care system, which is a really important problem and something that does need to be addressed. However, allowing a speedier termination of parental rights is just not the best step to take. Designating foster parents as non-relative kin after just 9 months is not in the best interest of families, so it's not in the best interest of children. Children do best. There are lots of studies on this, and I'm happy to send links if folks would like to read more. Children do best in their families of origin when those families are supported and able to have the treatment and support options that they need. So finally, this bill also includes new SNAP and TANF program reporting that puts an additional and just, we think, unnecessary administrative burden on DHHS. It's going to require substantial resources, which could better be spent addressing COVID-19, or now that 808 has passed, moving forward with Medicaid transformation. HB 918 only passed by slim margins in both chambers, so now is the time to contact the governor's office to request a veto, and also to ask your legislators to sustain a veto if one goes out. The bill is bad for kids, and we can stop it if we can all push just a little bit more. Kids and families in crisis really deserve better than what HB 918 is offering. A couple of other bills to note. HB 562 has been signed into law by Governor Cooper. We have talked about this bill before. It's known as the Second Chance Act. The bill makes several changes allowing for the expunction of criminal records, including a provision for the expunction of records of offenders under the age of 18 at the time of commission of certain misdemeanors and felonies upon completion of their sentence. So it's really giving a lot of people a new lease on life when it comes to a criminal history and background, and we are all for that here at NC Child. And then finally, I want to call attention to HB 295, just to remind you all that North Carolina is still the only state to have a statute allowing corporal punishment while no public schools actually use the practice. Tom Vitalione on our team has been championing this cause for years now, and a decade ago, most of our state's local public school districts used corporal punishment. By 2018, all 115 of those districts prohibited corporal punishment. Since then, despite a favorable vote in the House and widespread approval in the Senate, just a couple of lawmakers on the Senate Education Committee have been refusing to put HB 295 on the committee calendar. Their motives are really unknown, but Senate protocol allows them to block colleagues from even considering this bill. One of those legislators, coming full circle here, is Senator Tillman, who announced yesterday, as Ashley mentioned, that he will be retiring from the Senate this year. And that is all the updates from me. What do we have in the chat box?
Great question, Whitney. We have one from Dr. Clark Pearson about the Federal Family First Act playing into House Bill 918. The idea of supporting prevention and mental health to keep families together instead of sending kids into care.
Yeah, so this bill is basically just flying in the face of that recent federal legislation. It's opposite the goals of the Families First Act, right? The goal of HB 918 is absolutely not family reunification, which is what the Federal Family First Act is really all about. HB 918, as far as I'm aware at this point, is not illegal, but it is going to be difficult to meet the goals of Families First if HB 918 comes into law.
Thanks. I don't see any other questions in the chat box. If folks have questions for Whitney or Ashley, please go ahead and enter them now. And I'm going to stop the slideshow. Well, actually, I'll flip to the last slide, which is where you will be able to find the video of this call afterwards on our website. If you don't get our email updates, it says how to sign up for them. Oops. And remember that we do also provide a Spanish version of this video on our website. It'll be up there by the end of the day today. And I do see a question from Andrea Husong. Is there a Facebook posting we can circulate against 918 and a link with the information for a broader audience? I don't know that answer to that question. We can certainly find one, but Whitney, do you know? You're on mute, Whit.
I'm not aware of a single Facebook posting, but I'm sure that there is one that we can share. But there are graphics for social media that that we can share after the call. And Fawn, I'm not sure how people are contacted from our calls, but I'm happy to get those to you to get out to this broader audience on the call.
That's great. And I'm going to look for a link now. I believe the ACLU of North Carolina should have some stuff out, and I'll take a look and see if I can share that.
Great. So we will get those to you guys. Thank you. And also those graphics are available in English and Spanish. So if any of you out there are predominantly Spanish speaking, then it's also great to share those within Spanish speaking communities as well. We've seen a little bit of that on Twitter, but not as much on Facebook.
There's a question from Greg Borum. Does anyone know if House Bill 1102 on rental and mortgage assistance made it into any of those late night budget agreements?
I am not aware of that. Ashley, if you're still on the call, have you heard anything about 1102?
No, but we can track that language down and see if it did make it into any of the bills that emerged as conference reports. I don't remember seeing that in any of those bills, but we can certainly take a dive and see.
All right, I do not see more questions popping up in the chat box. Folks, any more questions for the team? Chris, someone at NC Justice Center spoke on housing recently. Yep, they may have more info too.
Okay.
Wonderful. Well, Whitney, thank you so much for your update, to you and Ashley and Vaughn and everybody else who were very diligent this legislative session and certainly throughout the past week, trying to stay on top of everything. And as you all know, it seems like oftentimes we spend as much time or more time stopping bad things as we do supporting the good things. But I think this legislative session, in the midst of COVID-19 and all else that's going on, we were able together to be productive and make some good things happen in the midst of that. And so thanks everyone, because it takes a group effort time and time again to get this done, and persistence. And speaking of that, just a few things to look on the horizon. While it's a couple months off, as was mentioned, the legislature will likely come back into session at some point to look at how to spend remaining coronavirus relief dollars. And it's going to be very important that we make our voices heard in that process and push forward to help make that happen. It's a dynamic situation. Things are changing each and every day, but we know the impacts on children and families are going to remain tremendous as we move through the rest of 2020, certainly into 2021. What's going to happen with the upcoming calendar school year, as well as many other issues that are going to continue to be in the forefront of people's minds. Also federally, we're going to continue to push to try to get some good things into a federal stimulus bill or coronavirus relief bill that, from what we're hearing, will probably come out later in July, hopefully a compromise between the U.S. House and Senate. And particularly, we're looking at provisions around SNAP, Medicaid, housing, some other key issues, and we'll keep you all posted on those and ways to take action as we move forward as well. I know many of you have already done that on several of those fronts. And I also just want to mention again, and you'll be seeing more about this, our 2020 Kids virtual conference is coming up August 4th and 5th. And we're very excited that we're going to move forward and have that conference. It's about building racial equity in child advocacy. And there's no more important time to be talking about that than now. I think the issue of House Bill 918 was one example of racial bias that we see that's being put forward regardless of intent, but looking at impact, as Whitney mentioned, and something that I think people are becoming more aware of and wanting to advocate around when we talk about some of these issues of systemic racism and how we can make the system better for all our children. And so 2020 Kids will have some great speakers, some great workshops. We'll be talking about building equity moving forward into the future here in North Carolina. Does anyone have any other questions or comments?
Adam, I'm just going to share that we don't have an update next week. It'll be the July 4th weekend, so we're giving the legislative team the week off, and then we're going to have a full wrap up and deep dive on the 2020 session on Friday, July the 10th.
Wonderful. So to everyone, hope you have a wonderful 4th of July holiday. And if you have any other questions or needs, please be in touch with NC Child. Have a great day. Thanks.